I am going to be doing my presentation of our meningitis project. Starting off with patient number 15, which is Tiana M., who was a 2-week-old baby who went through a normal birth, and mother stated that she had no problems during her pregnancy. However, recently, Tiana has been getting a lot of fever, irritability, and trouble feeding, however, has been sleeping more than usual. For our CSF results, we can see that Tiana has 23,000 leukocytes, which is more than the normal CSF levels. She also has 74% neutrophils, which is a little above normal. She has 24 milligrams per deciliter of glucose, which is below normal, and she has 830 milligrams per deciliter of protein, which is way above normal. Based on those results, we can say since she had elevated leukocytes as well as neutrophils and protein, yet low glucose levels, this is most likely to be bacterial meningitis. Down below, we listed a couple possible pathogens such as Neisseria meningitis, Streptococcus pneumoniae, etc. We then went ahead and ordered some stain and media tests in order to pinpoint which of our possible pathogens may be the cause for baby Tiana's symptoms. We started off by our gram stain in order to see the shape and arrangement, as well if they are gram positive or gram negative. We do know that Streptococcus, Listeria, and Mycobacterium are all gram positive, therefore they would have a purple stain. Also, we do know that Listeria would be the only pathogen to show diplobacilli. Next, we ordered endospore and an acid-fast stain, where an acid-fast stain would pinpoint if this was Mycobacterium, since it is one of the only pathogens that are acid-fast. Next, we ordered a blood agar, which would show us the hemolysis, as well as a chocolate agar and a McConkey's agar, which is selective for E. coli, as well as a Thayer's, which is selective for N. meningitis. Lastly, we also ordered an eosin methylene blue agar. Once we got our results back, the first thing we were able to notice is that we have a gram-negative bacilli pathogen with no endospores and non-acid fast, since it's stained blue. Next, we can see that it grew on our nutrient agar, as well as our blood agar, and our blood agar showed us that it is beta hemolytic. Then we can see that it also grew on our chocolate agar, and key point, as we can see on the picture on the right, it grew on McConkey's agar, which is selective for E. coli. So at this moment, we were already pinpointing E. coli as our most likable pathogen. However, we still went ahead and let our last agar in order to make sure that this could be E. coli. Our last one was eosin methylene blue, as we could see here. It also grew on. Therefore, we were pretty sure that this could be E. coli. Now, for treatment and prognosis, there are currently no treatments that can cure E. coli. Therefore, the best thing that our patient would have to do is make sure to be drinking a lot of clear fluids in order to avoid dehydration and fatigue. Also, the mother would have to avoid giving the baby any apple juice or pear juice, as well as avoid certain foods such as dairy, fatty foods, high fiber, or highly seasoned foods. Also, it is not recommended to give the baby any anti-diarrheal medications, since that does slow the digestive system down. Also, antibiotics are not recommended since they can cause a risk of serious complications. However, the symptoms should go away in 5 to 10 days. If they don't, and if they get worse, it is important for the mother to take the baby to see a healthcare specialist, because E. coli can lead to hemolytic uremic syndrome, which can be very dangerous if not treated. Next, we have patient number 135, which is Alex P., who is a 25-year-old forest ranger, monitors mosquitoes, and frequently gets bitten by them, even though he does wear mosquito repellent. Our patient has been reporting to have a lot of stiff neck as well as headaches, and the ER physician reported some photosensitivity. As of our CSF results, we can see that he had 72 leukocytes, which once again is above the normal CSF levels. He had a 14% of neutrophils, which is below normal. He had 67 milligrams per deciliter, which is between normal, and he had 62 milligrams per deciliter of protein, which is a little bit above normal. This then led us to conclude that since he has high leukocytes and low neutrophils and slightly elevated protein levels, this is most likely to be viral meningitis. Key point, we believe this to be West Nile virus since it does can be transmitted by mosquitoes, which is what our patient works around. Therefore, in order to confirm our theory, we went ahead and submitted a serological test, and that showed us that it was negative for IgM, however negative for IgG and positive for IgM, meaning that this was not a pathogen that is recently in the body. However, it was there at one point in time. However, it is 100% sure likely that if it is West Nile virus, it would not be by a vaccination, since West Nile virus does not have a vaccination as of now. Key point, it is good to remember that there can be false negatives that may occur. Therefore, we conclude that based on our symptoms as well as our patient's history, this is most likely to be a West Nile virus, since he does work a lot with mosquitoes, and we know that the West Nile virus can be transmitted by mosquitoes, and it circulates a lot in birds and a lot of wild animals that our ranger might work with. As a treatment and prognosis, it is recommendable for our patient to take over-the-counter medications for his stiff neck as well as his headaches. There is currently no cure once again. However, it is recommended for him to be sure to protect himself, again, wearing a lot of mosquito repellent, also wearing long sleeves, long pants, boots, hats, and also a face shield in order to protect himself from getting bitten even more by mosquitoes. In conclusion, this should go away in a few weeks. If it doesn't, once again, it is important to go to a healthcare provider if symptoms get worse or if he starts seeing other things happen to his body. Overall, this was our project, and I hope you enjoyed my presentation. Thank you.